Hi, I'm Denny Flint from Complete Practice Resources. Welcome to this demonstration of Ready10, the only web-based, task-driven virtual consultant of its kind for the ICD-10 transition. After conducting hundreds of on-site ICD-10 workshops, what's become clear is that most healthcare organizations understand ICD-10 is coming, but don't have a clear sense of what to do or how to get started. That's what Ready10 will do for you. This project management solution was developed after performing over 50 ICD-10 implementations and readiness assessments in real-world healthcare practice environments. For under $600, there is no more affordable, comprehensive, or easy-to-use ICD-10 implementation solution on the market today. To demonstrate the Ready10, I'm going to show you how simple it is to accomplish the top 3 things you need to do right now to kickstart your ICD-10 transition. What you're looking at now is a search page of the conversion component of the Ready10 software. The most important first step is to convert your most commonly used ICD-9 codes into ICD-10 so you know what you're dealing with. That way we demystify ICD-10. It's not that ICD-10 itself is that complicated. What's important to understand is that basically if there's an elevator speech, doctors got to write down more stuff. So let's demystify by showing how easy it is to convert from ICD-9 to ICD-10. You'll note in looking at this screen, you can convert from 9 to 10 and vice versa. You can save favorites and create specialty-specific custom flashcards. You can search by the exact code, all words, exact phrase, or any word, even partial words work. Let's show you how easy it is to do a conversion. We'll use 493.90 as an example. Asthma unspecified. To convert, you simply click a button and there it is. The conversion component is based on the GEMS software database developed by CMS, but the shortcomings with the GEMS database was that if you put in an unspecified search value like 493.90, you're only going to get unspecified ICD-10 codes back out, which is not helpful when it comes to educating and training your providers on what's really important. So you can see what we've done is we've created this proprietary crosswalk, all those codes in pink, that offer the alternate code choices, the more specific code choices that contain the new documentation elements. For example, now we see that with asthma we have to document mild, moderate, or severe, intermittent or persistent, as well as at the bottom you can see we also have additional codes required for tobacco use or exposure. You can actually print the conversion list, save it to PDF, which makes it really easy to distribute around the practice. We also give the ability to create those specialty-specific custom flashcards. So if I wanted to create a flashcard for asthma, this is how easy it is. We now have seen the new documentation elements, mild, moderate, severe, intermittent, or persistent. So I simply highlight those, right-click, and create a flashcard. You can give it a custom title if you like, but there it is. It comes out in a 4x6 format. Again, you can save it to PDF or up to the top right-hand corner. You can see we have a flashcard library. But in this way, we've demystified ICD-10, and Ready10 makes it really easy to do that. Convert your top 20 codes, create these flashcards, get your doctors educated about the new documentation elements, and you've got a great way to kickstart your transition. All right, now let's talk about the second most important thing to kickstart the ICD-10 implementation. Before I do that, I want to walk you through the Ready10 project management component. You can see it's laid out in what we call a sane, measured, and phased approach, with the first phase being creating awareness throughout your practice. You'll also notice that with each phase, we've also got embedded videos and background information that give clear, succinct, step-by-step instructions for every task, every milestone, and every question that needs to be asked. Once you create that awareness, the idea being that you can't really implement something you don't know much about, then we move into phase 2, which we call the kind of the get ready to get ready phase. That's where the bulk of your ICD-10 implementation work will occur. In that phase, we'll create our team, we'll write some rules of the road with project charters and communication plans, and by the way, wherever possible, as you can see, we've created content for you, so you don't have to go in and reinvent the wheel. Also in phase 2, we give the ability to identify all those important external stakeholders with whom you have to work to determine their readiness level. You know, ICD-10 would be an easy project if it were just an internal project, but it's not. What you have to do is coordinate and communicate with all those external stakeholders with whom you have to work. Vendors, payers, OT, PT, DME, all of your labs, imaging group, virtually anybody to whom you have to enter an order. Also in Phase 2, we've got our chart review section, which allows you to easily record and report on current documentation shortfalls, and I'll show you that in more detail in just a second. The impact assessment in Phase 2, virtually everywhere an ICD-9 code touches your practice, there will be ICD-10 impact. So each of those areas we've created questions, tasks, and milestones. The beauty of the Ready10 is that by the time you get to Phase 3, in Phase 2, all of your plan creation, including training and budgets, being created for you behind the scenes. Phase 4, the actual implementation, all that's left to do is really to sit back and monitor deadlines and accountability. And we've also taken the Ready10 one step further into Phase 5. No one can tell your practice exactly what ICD-10 is going to do to you until after it's been implemented. So what we've done is we've given the ability to monitor and assess certain metrics that will be affected by ICD-10, such as revenue by payer, provider productivity, and expense line items. But let's get back to the second most important thing to kickstart your ICD-10 transition, and that's the chart review. It's important to conduct current chart reviews for two reasons. Number one, you want to identify your current documentation shortfalls in regards to ICD-10. And number two, you want to create report cards that help identify which providers need the most help. It's a great way to motivate your folks. So let's take a look at a chart review. We're going to do a chart review based on our top 20 most frequently reported ICD-9 codes. In this case, we'll do a chart review for 250.52, which as you can see is diabetes with ophthalmic manifestations. I'm going to do a chart review for, let's say, Dr. Craig. We can actually track who coded this particular encounter and who's reviewing it. The first step is to convert that 250.52 so we know what we're dealing with. To do that, we simply click this button, and there are your ICD-10 codes. Now we're going to pull a chart for Dr. Craig with 250.52. We're going to take a look at the current documentation elements and see if they satisfy the specific choice of a very detailed ICD-10 code. If the chart passes, simply click yes. The chart passed. If not, click no and tell Dr. Craig why the chart didn't pass. In this example, let's say Dr. Craig did a good job capturing diabetic retinopathy but failed to capture macular edema. So I'm just going to type that right in. Now I can actually create this report with a simple right click. I can print preview. I can click that report, create a specialty customized report for Dr. Craig for that code for that chart. There is no more powerful educational event in ICD-10 training than using codes the doctors actually use and charts they've actually created. Now the beauty of the Ready10 is all of these results roll up into a chart review result report card. And that looks like this. As a former administrator of a large multi-specialty group, I can tell you there's no better way to get providers' attention than by issuing report cards. They're very competitive. And in this case, if this is our report card and I find that only 40% of Dr. Bell's charts passed, but 80 to 90% of all my other providers' charts passed, now I have a clear sense that Dr. Bell's going to need some additional training. We also give the ability to create an Excel spreadsheet with a summary of all the chart review results that you've created. So that's the second most important thing you need to do to kickstart the ICD-10 transition. And notice those are both related to your providers. In over 50 ICD-10 implementations that we've already done, the biggest challenge, the single largest challenge in the ICD-10 transition is finding ways to motivate your providers towards this significant change. So that's the first two things. What's the third thing? Well, as we mentioned before, one of your biggest challenges is coordinating ICD-10 readiness with all those external stakeholders. So let's take a look at the third thing you need to do to kickstart your transition. That's your healthcare software vendor. Don't be satisfied with an answer from your vendor that says, don't worry about ICD-10, we've got your back, we're going to be ready. That's not a good answer. But that's also not the question you need to ask. So what we've done is we've created all of the questions you need to ask your vendors to determine their readiness. They're your most important business partner. What are some of these questions? Well, when will ICD-10 be deployed in our practice so we can start training and we can start internally testing and modeling? Will there be downtime as a result of the deployment? Will we lose current customization? Will it support a dual-track coding environment for both 9 and 10? Who's paying for this upgrade? A lot of practices haven't even asked that question yet. Another important question, when are we going to test? How are we going to test? What's that testing going to look like? And who's coordinating the scheduling for the testing? The beauty of Ready10 is that you don't have to go invent all of these questions. You don't have to recreate or create all of this information. It's all here in easy to use, easy to find modules. What are some other important aspects of Ready10? Well, with any project, one of the key areas to determine success is creating deadlines and accountability. Let's talk about creating a task and showing you how to create those deadlines and accountabilities. And we'll do that with the video. This is our task, watch engaging and educating physicians and staff. It's a 12-minute video that talks specifically to the providers, billers, coders, and clinic managers about their role and the importance of their roles in the ICD-10 transition. To assign this task, we simply click Show Tasks. Here's your task. Watch the introductory video. We've already loaded all of our team members in the Administrative tab. So to assign the task, we simply click on their name. We can do it role-based. So if we just want the physicians and the providers to watch the video, we click on their role. Or in this case, I can add all staff, because we think it's important for all your staff members to have a clear sense of what ICD-10 is. Now with any task, we need a start date and an end date. So with this particular task, we'll start the task, let's say January 10th. We'll give everybody a week to watch it. So your end line or your deadline is January 17th. When I click Save Change, every member on your team who's been assigned this task is automatically generated an email. And the email basically says, watch the introductory video, your deadline is January 17th, and upon completion, click this button. When they click complete, their name turns green. If they go past the deadline, their name turns red. So you have an immediate visual view of who may need some extra time or who may need some extra help in accomplishing a task. All of your tasks and milestones roll up into an automated project management calendar that's actually color-coded. Anything in red is overdue according to the deadlines you set. Anything in green is complete. Anything in blue is pending. We also have the ability to generate a project plan in a text format. So if you've got board of directors or physician oversight groups that want to know, hey, how's our ICD-10 project coming? You've got an easy project plan that will illustrate and highlight not only all of your start dates, but your due dates for each and every task and milestone. What's another important area for completion for the ICD-10 transition? Well, one of the biggest challenges we found was creating budgets. It's hard to go back midstream and recreate budget items, so it's much preferable to do it as you go. So let's take progress note templates and EHR pick lists, for example. We know that those templates have to be updated for ICD-10. If I'm going to utilize internal staff to do it, I want to track how many hours it's going to take them to do it, because if they're doing ICD-10 work, that means they're not able to do their real job. So my internal staff says, yes, we can adjust the templates, we can rewrite them, but it's going to take 18 hours. Or if I want to bring in an external consulting group, maybe my vendor says, we'll readjust and rewrite your templates, but it's going to cost $6,000. Now I'm creating my budget as I go. By clicking Save Change, this automatically rolls up into an automated budget that compares deadlines, that compares estimated staff hours, estimated versus allocated versus actual cost. So in this case, with my EHR template, you can see We only budgeted $500. We were just told it's going to cost $6,000. Now in real time, my project oversight group, my project team can look at the budget at any point during the project itself and compare how we're doing versus budget, along with estimated staff hours to complete. And then as actual costs are determined, we simply enter those so we have an exact view of exactly what ICD-10 is going to cost. The final thing I'll show you is the post-transition phase 5 monitoring of important metrics. And you can see those metrics: total revenue, revenue by payer, provider productivity, etc. Let's take a look at revenue by payer, for example. I want to know where ICD-10 is causing us the most problem. So let's take a look at United Health, for example. If I look down my list and I see United is off 35%, that drop is inconsistent with the drops I experienced with my other commercial payers. Now I know I have a problem with United. So I can call United and I can say, why is our revenue decreasing so dramatically? In conjunction with the denial report, I can now drill down to where ICD-10 is giving me problems and hopefully quickly mitigate it. Let's take a look at provider productivity as well. For provider productivity, we monitor both number of visits and revenue by provider. So if I look at this graph and I say, wow, Dr. Jones' number of visits is off 25% over this time last year, and that drop is inconsistent with that experienced by Dr. Howe's, now I know I need to dedicate more resources to Dr. Jones to get her through the transition. The beauty of the Ready10 also is that it's vendor neutral. It works independently of your EHR, so you don't have to worry about integration. Without Ready10, you're faced with two prospects. You either have to figure all this out on your own, which means managing dozens of loose spreadsheets, manually assigning tasks, and researching all the questions you need to ask your external stakeholders, or you may have to bring in costly outside expertise. As you saw, Ready10 is an easy-to-use, affordable solution that enables you to achieve ICD-10 implementation success. And don't forget, for those organizations needing extra assistance, the Ready10 Pro package includes 5 hours of remote consulting, 50 chart reviews, and conversion of your top 20 codes. There's a reason this tool was unanimously chosen as the solution of choice for gold standard organizations such as the Texas Medical Association and the ICD-10 Training Coalition. Thank you for watching. We look forward to supporting you in your ICD-10 implementation efforts.
And it starts sometime around midnight.